Hi everyone, Dr. David Cullah here. This is for people with severe costochondritis, this video. There's a lot of people out there really struggling. I get it, I understand the frustration. We have someone here that has gone through everything you've gone through, okay? This young lady here, Paula, she's on disability. She hasn't been able to work, couldn't raise her arms when I first saw her. She was in tears, straight up in tears. And then it was just painful for her to cry or laugh or anything. Now I see her laugh, and I gotta be honest, that's my favorite part. Like just yet, 2 days ago, she was in here and she was laughing. Her boyfriend said a joke and she was laughing. And that was, for me, the best feeling. Laughter is some of the best medicine, isn't it? So we're going to go over her case, really severe case. And a lot of you, did you use the back pod?
Yes, I did.
Okay. So I've done videos on the back pod. Don't get me started on that, okay? The back pod, did it help?
No, I think my case was too severe. I think I just couldn't get the position right. No.
Yeah, again, watch my back pod videos if you're interested. That's not what this video is about, right? So I talk about the 4 phases of care for costochondritis, and phase 1 is reducing inflammation. Phase 2 is stretching, right? Phase 3 is thoracic mobility. But what we're able to do here is we were able to do phase 1 right away, and then within a week, maybe it was 2 weeks, I gave you stretches. So she was a severe case. Sometimes we're able to do phase 1 and 2 at the same time. Her case was so severe, I couldn't adjust her. I couldn't do anything for the first few visits. So we had to get the inflammation down, the pain down. Then we introduced stretching pretty quickly. So the advantage of seeing a chiropractor and having this addressed properly, they can address the inflammation. Laser therapy is the best way to do that, okay? I don't know about those cheap lasers on Amazon. I can't account for those. But the ones that we use, clinical lasers, they work great, wouldn't you say?
Absolutely.
Yeah, and, so we were able to do that. Then we were able to introduce phase 3, thoracic and rib mobility, very quickly, along with the stretches. And now we're at 8 weeks. Yeah, 8 weeks. So people ask, how long does it take to get better? You know, people go for like a week or 2 to the chiropractor or a couple of visits. It made it worse. Yeah, it could make it worse initially. She had 1 flare-up in the past 8 weeks, and it lasted about a week, right?
Yeah.
Yeah, and it was a bad flare-up. I mean, she was already in a bad pain. Like, if you could say pain level is the highest at 10, you had 11. I mean...
Yeah, it was pretty bad.
In tears. So now we've got her, how much improvement?
About like 50, just over 50% over the course.
Okay, so we're a little bit over 50%. She's regaining her life back again, but now the key is we've gotten a lot of the inflammation down. We've increased thoracic mobility, worked through all the stretches. Now for her, it's strengthening. So she's in that last phase of care, but we're still doing cold laser therapy on her because this is a severe case. And we're also doing thoracic and rib mobility chiropractic adjustments. And she's doing some of her own homework, but I want you guys to know there is hope, okay? And she's an example of that hope, okay? Just stay the course. If you have a severe case, it can take 3 months, even 4 in really severe cases to get through this. Now, she also happened to have acid reflux and GERD, a hiatal hernia too, which made this problem worse. So we're going to do the hiatal hernia. We've been doing the hiatal hernia maneuver on her. She'll probably take my patented product, the Reflux Shield, home to just be able to manage that on her own. She's a sloucher. You can see her shoulders are rolled forward, okay? I'm not going to fix that overnight, but the Reflux Shield will help with the hiatal hernia, pulling the stomach down and allowing her rib cage and diaphragm to raise and lower like it should. And that can certainly trigger or make costochondritis worse If you haven't seen those videos, please check those out. We've done a few videos of people with both, people that thought they had a hiatal hernia and they had costochondritis, people that thought they had costochondritis and they had the other, all different variations. But I just wanted to do this video to show you that there is hope. She's already gotten that hope in 8 weeks, and I would like to speed this up. I would have liked to do this in 8 days. That's just not how the body works. So stay in there, folks, and just know that you will get through this, right?
Yeah, you can do it.
God bless you all. Thanks for tuning in. Thank you guys so much. If you got anything from this video, or even if you just like this view of the Empire State Building and the Chrysler Building, give me a like and don't forget to subscribe. Appreciate you guys.